Oh, this is awesome. I love it. Good day, everybody. Welcome, everyone, to Dental Voice Season 2 with Zyrus. My name is Rolando Mir, and today we have returning guests. The purpose of Dental Voice is to hear directly from clinicians, understand the experiences, the perspective, and get advice from them regarding things that they're dealing with. Today, we're rejoined by Dr. Paul Bylis. Dr. Paul, oh my goodness, was our one of our early guests, been on the about 4 or 5 months. Can you believe that? I believe that's Dr. Paul. Thank you for joining. How are you, sir?
I'm doing well, thanks. Thanks for having me.
So, since we last talked, so many things have happened here. So many, just you name it. You expressed to us ideas or thoughts about what was going to happen. What has changed with you between then and now? Let me guess.
Yeah, we're certainly up the game as far as precautions. But it's become the new norm, and we've adapted, and my team has adapted. The patients are appreciative of the efforts we make, and things are running smooth. It's just just different.
So wait a minute. Are you Dr. Paul Bylis? You're in your office, right? So
Yeah,
let's talk about.
it feels funny. I mean, I'm gonna take. I'll take off my mask, but it's like almost hard to do. I mean, when we get in the office, except when my team goes two at a time at a 10-foot conference table to take a lunch break at social distance, nobody drops a mask. So we walk around this way, literally from 7 o'clock in the morning till 3:30 in the afternoon. Yeah.
How does it feel? Help us understand the experience.
Well, I mean, at first it was extremely difficult as far, you felt uncomfortable with your breathing and all, but it becomes acceptable and you get used to it. And, my ears are a little raw behind there. I'm going to try to get something with some buttons to help me out. The shield, I've got several $1,000s of optics and I got a $2 piece of plastic over it, shedding a glare. So I'm a little unhappy about that. But, you have to get used to the new preventive measures.
Holy cow! So take us through what it is, or you go ahead.
Well, I was fortunate. I mean, we went through like a million shields, but this one, you know, comes down and clears my loops and my light. I had to take off the light shield, which I had to get used to. I liked having that, but I can't really use it appropriately in the operatory with this down. So, I mean, so that's the shield. This one works really well. Some of my team who are not wearing optics wears, a different type. And, so that's that. And then, look, we were wearing masks before. I mean, I'm wearing a head covering, because that's the rules. We have now a linen service. My Seattle Study Club, some of those guys were really proactive and got together with and got some good deals with a linen company for our group, and that's been nice versus the disposables, which were difficult to obtain.
Holy cow! And then the masks.
Yeah, so mask is a level 3, level 3 with the shield. I mean, my team has some are wearing N95s and some are wearing level 3. I was having a tough time with the N95 as far as breathing, so the level 3 with the shield, we feel is a good a good alternative.
And so I'm curious. It's now been 4 or 5 months, 4 months since we've all
Right.
come. Are you feeling that you've been acclimated? Are you acclimated to the new this new protocol now?
Yeah, I mean, it's kind of strange how you adapt, and the patients adapt. And it was kind of awkward when they were originally coming in, but patients understand. They come to the front desk, and my front desk, which is in a mask and a shield, and gloved, are gonna take their temperature. And we now have we went to paperless forms on an iPad that we can wipe down. So, or they could do it, prior to coming in online. We changed our credit card reader to touchless, and they don't have to put a signature on it. So, and my team has their controls, the patient has their controls. If there is signage, we have a thing of clean pens and a little bucket for the ones that have been used. Everything is wiped down. So, at first that people were missing those cues, but now they come in, they put their forehead forward. They know you're going to take the temperature, right? We went from like 15, 16 chairs in the reception area to 6. The patients aren't being offended if the people they come with have to sit outside in the car. It's just, this is the new rules, right? And everybody's very respectful of it.
And just settling, and that's so cool. So I'm curious. You've been practicing how many years now, Dr. Paul?
I don't know. What's 1987?
So 30 something years. So you were in the midst of the HIV crisis,
oh, yeah.
Correct?
Mm-hmm.
When everything changed because of this bloodborne pathogen.
Right.
Now, do you see, is this as big a change for you and the team with regard to the way you're operating as that was? Or and how long did it take you to kind of settle or acclimate to that?
No, this is nothing compared to me, compared to HIV. I was working for my ex-partner, and I would not have wanted to be in his shoes. I mean, we weren't autoclaving hand pieces. We weren't we weren't changing out chip syringes. We weren't wearing masks. We weren't wearing gloves. We had cold, sterile things. We put things in. All the burrs were sitting out. I mean, it was a different time, and those
Right.
changes. The hand pieces weren't. The first generation of hand pieces weren't reliable. The bearings seized when they were getting cooked. The first generation of quick disconnects. They weren't. They didn't work very well. This is so it took to wear gloves, to wear a mask, to make those original changes I think was absolutely revolutionary and a difficult big step. We're doing everything. I mean, we added I added a head covering and a full gown and a shield, but pretty much, I mean, we added some things that are kind of cool that maybe we wouldn't have done. I have, we have hospital grade air purification going on in the back now. We have hypochlorous acid foggers. We have, of course, I use the isolite. So we have a lot of steps we've taken that aren't even on the radar or required that patients just love to see and hear. They feel much more comfortable knowing. That's
so cool. So what effect has COVID and all these extra procedures, the time, all that, what effect has it had on kind of the workflow? And how's your team adjusting to that as you're navigating, as you're getting back into the routine?
The team has adapted beautifully. I mean, they're all gung ho. They all want to be safe for their families. They all want to be safe for their patients. The patients get it. I think when all this leaves, I'm not going to take down the air purification system. I think that's great. I'm not going to stop using the hypochlorous acid fogger. I think it adds another layer of safety on for the whole protocol of disinfection. So so there's a lot of good things happening too. I mean, I will take the damn shield off and and you know what? I'm going to pull the mask. I mean, I feel funny pulling the mask off in the office, but I mean, I'm in a closed room, everybody, so no one, So yeah.
There you go.
Yeah, I mean, but it's everybody is doing their part. I mean, I think it's just again the new norm.
That's cool. And is your practice, how is it going with your practice? Is your practice busy? Are you seeing the same, there was a kind of an unsure deal early on whether people would be coming back, whether you'd have the same level. Are you seeing the same pace?
Yeah, I mean, I think we're probably, doing like you see in the country. It sounds like everybody is, patients are coming back at about, I read from the ADA around 70-something%. I think we're about 80%. we're working and we're conducting business. I mean, I'm very, very pleased with how things are running right now.
That is so cool. It's interesting because as a when you consider practices and all, we've been talking to a lot of clinicians,
Right.
and there are two primary or big issues. One was, will the patients be coming back?
Right.
And it sounds like they are coming back with you, and it's good to hear. The second issue had to do with kind of potential anxiety with the team because of the fear of infection.
Right.
Are you seeing that with your team?
Yeah, that was a huge issue for, I mean, especially I think team members, and rightfully so. I mean, there were a lot of unknowns, but as they saw how effective the PPE is, we had we had patients that came from other states that did end up testing positive and telling us that this was an issue. But ending up hospitalized. But nobody in the office team got disease, and none of the patients got disease because of the protocols we're taking, and it was very comforting to see that all the protocols we have in place work. So I mean, as long as you're wearing your mask and got the PPE on and you're doing everything we've done before with a few little extras, I think everybody is safe.
And first of all, that's great. Are you experiencing any with regard to your teammates, any issues there and all that?
I'm sorry, say again.
With regard to your team, are you seeing any? Is there any disruption that's happening with that?
Any disruption to
your team?
To the team? No, I mean, they've got some of them with children. I mean, have a lot on their plate, and it's amazing how well they're balancing it. Because they've got the child that has to be schooled from home or whatnot. But we do whatever we can to flex schedules and make sure that they can do their thing and we can stay operational, even if my daughter and I have to change our schedule a little bit.
That is cool. So we talked about technologies in the practice,
right?
And when we look at as this is happening, there were a lot of things that we were considering. What worked? What didn't?
As far as tech, everything. I mean, we were sitting there dragging our feet on going paperless. So this was a kick in the butt to say, okay, now's a good time. So we've begun that process, and once you overcome inertia and get past that change, it's pretty easy. And then you kick yourself like, why the hell didn't you do it, a couple of years ago? So all that's good stuff, and we've again, I mean, we already have. As far as tech, you're talking about just based on this disease. I mean, that's really all we've done to push forward.
That's cool. So aerosols. That was and continues to be a big issue.
Yeah.
And you mentioned last time that you felt comfortable that Isolite,
right,
as well as other PPE, was effective in minimizing that. Are you actually seeing that in the day-to-day, or is it just something you're believing that we're saying?
No, I mean, listen. I never bought the product for aerosol. I bought it because I felt that anybody who's using it is a better clinician. You can practice at a higher standard. You got a safer environment. You're faster. I mean, you win on everybody wins on that. It's easier on your team. It's easier on the patient. So, I mean, what's not to, how could you not use it, right? But the aerosol thing was not on the radar for me. But obviously now, we've extended the use now to hygiene, and they're using the ISO vac, and then so then the new rule in our practice is if they're doing a hygiene visit, if they want to use a Cavitron or a piezoelectric scaler, that's going to stir up a lot of vapor. The patient has to comply with an isolate, otherwise they have to hand scale. So, and we don't get much pushback on it, so it's been almost universal that we've been able to practice the same.
So that's cool. So you tell the patient, or you communicate to them that, hey, this is going to generate a lot of aerosol. You're required to use this to help minimize that, and your patients are okay.
Oh yeah, I mean that's they're better than okay. I mean they're I think a lot of the patients are like this telling me that besides picking up groceries, the only place they've been is to our office since March, and there's a level of comfort and trust that we're doing everything to protect them. So and again with the I mean they see what we're wearing, they see how we're operating, and they love the fact. I mean, they truly love the fact that we've got the isolite in effect, that we do have a hypochlorous acid fogger to take it to the next level, to make sure that we spray the air and ourselves between patients, and that we have, hospital grade air purification systems that filter to 0.001 micron 24/7. When we're not here, it just runs. It's no on-off switch. You have to go into the ceiling and unplug it, so.
I love the fact that you just decided to go over the top from the get-go, and we're just going to do this. So that is so cool. Let me ask.
Yeah.
Elaine, Dr. Elaine, is your daughter, and she got a vaccine thing.
Yeah, maybe.
It was one of the test subjects. You are too, yes or no?
Yes. Yeah.
How was that? What was that all about?
Well, I mean, Moderna was reached out, and they were looking to get 30,000 people to participate at 90 sites in the country. So they gave 30,000 injections, and my daughter and I are 2 of those 30,000. It's a series of 2 injections. But anyway, it's 15,000 placebo, where you got a saline shot, and 15,000 vaccines given. So neither one of us know if we're protected or not, but it's a 2-year study, and we felt that it was important, to participate, because they were looking specifically for people who are kind of frontline and had to deal in close contact with people like we are with we actually no mask on.
And so you feel fine.
Oh, yeah.
You didn't grow a third arm or.
Yeah, I do. I feel great. I have, I have to fill out a diary. I got to talk to the lady on the phone once a week. And, when I go there, they pull, a bunch of tubes of blood every time and poke and prod you. And, yeah, I mean, both of us feel fine. We probably both got saline. I don't know.
And as far as vaccines, as far as the context around that, so you believe in the vaccine, you believe in and you're going to take it, and is that something that you would suggest or advocate for patients?
Yeah. Oh my God! I mean, look, the science works. I mean, we know that. I mean, nobody's getting polio right now, right? I mean, it's. I mean, no, we've done it for years. I mean, so I mean, when the shingles vaccine came out, I mean, shoot me up. I don't want shingles. I mean, I got the pneumonia one. I mean, if they've got a vaccine, I don't like getting an injection, but I don't want disease if I can avoid it. So I mean, I get the flu shot. I mean, so yeah, this is. I mean, this is the Moderna one is actually a synthetic component where they're making synthetic messenger RNA to target this specific virus. So there's a lot of potential good stuff that could happen. As does in times of crisis, where brilliant minds put their heads together for the good of mankind, and we come up with tremendous solutions to help. So it's all good.
So that's so good to hear. As far as have you communicated your level of communication to your patients? Has it remained the same? Increased? What are you still letting them know?
As far as
What you're doing?
I mean, if it comes up, I mean, we're not. If the vaccine thing comes up, I mean, I'll mention that, we're gung ho as far as vaccines, and I think it's important that everybody, gets vaccinated when it's available. But otherwise, I mean, we're not really disseminating that aspect. But it is a little tougher to have a conversation with a patient with a mask on. I find that when I have to get long-winded, which I tend to do, I have to suck in some extra air, in between, because I feel like I'm short of breath. But we're getting through it. I mean, it's sometimes I have to ask the patient under the mask to say it again. They're asking me to say it again. Without seeing their mouth, sometimes you don't realize that you really do pick up a lot of speech just by watching the person.
So there are practices out there that still potentially haven't opened. Are you seeing patients, or are you experiencing that in your local area?
Yeah, we have. There's one practice. We actually just had a patient yesterday that came from a practice that's been shut down since March. I don't know. I mean, I don't know why, but it hasn't reopened. So that patient was, Googled and found us, and all right, so that was it. So
as a successful, long-standing, independent practice with your daughter and a succession time, what is the basically you've broken the code. What advice would you give others out there who are doing the same thing? Because you're not part of a group, are you?
No.
Yeah. So how are you navigating through that, and especially with COVID and everything going on? What's the message, or what's the advice? What would you tell people who want to do the same thing?
Well, I mean, if in a small practice, I mean, you've got to be. You have to have the whole team vested to come up with, on the same mission to patient first, to try to come up with ways to make the practice, the safest environment we can, for everybody's good. I'm fortunate enough to have my wife involved with the practice, so that's absolutely huge to take a big load off to on a lot of the details on and regulations and to help move us forward with some of the innovations. So that was all kudos to her as far as going paperless and helping to if I say I want the air purification, she did a lot of the research to find the best one. So I'm very fortunate to have Elaine and Betsy to watch my back.
I hear Betsy Bylis is really the brains behind this whole operation. Is that true?
She's the boss of me, Rolando. You have your boss, I've got mine.
So last time we talked, and I want you to tell me, there was a little incident that occurred during the course
I think I was doing just that, laughing.
of our session, and during that incident, something happened. What happened?
Well, my daughter was doing a full rehab on my upper arch, replacing my veneers from 3 to 14, and I was in my provisionals. And just before your show, my wife had stopped at a Einstein Bagels and got me a bagel like this big. And like an idiot, I took that first bite and I heard that crack, and I broke out the front 3 teeth. So, but it snapped back in. We made it through the whole thing. Last 2 minutes, right? I had a big laugh and they came out. But now everything.
Because Elaine claims that she had a non-compliant patient.
It is. I'm big
with a cohort with a topless.
Yeah. Oh, yeah. No, I knew all the rules. I mean, you should hear me give post-op instructions now. Big
and
neighbor was on the list.
how are you now?
Oh yeah, I
Oh,
got
look.
a grill, man. I got the best smile in town. Covered with a mask all the time, but it's
Oh. So with this mask in your patients, are you seeing patients with more decay, more issues because it's been so long since they've been in the practice?
No, I don't think anything's changed as far as that. There were patients that missed appointments, and we had a backlog that we had to, muscle through. And again, that was a team effort. Everybody had to help to make sure. Including my daughter and I, we had hygiene patients in our schedule also to try to, take care of the flow. And at the beginning, that was actually fun. It was kind of cool to get that kind of one-on-one with the patients under those circumstances. And we were at a slow load as far as how we were doing things anyway. So we were kind of feeling our way around. So it was a nice segue back.
And no problems.
No problems. No.
That's cool. So with regard to going forward, with regard to kind of, we heard that COVID is an accelerator for us doing things that we need to. How do you see kind of the future shaping up through all of this, and kind of what are your thoughts regarding, the next 3-6 months, years?
Well, I'm hoping, within a year they'll have a vaccine available, and so there'll be a little bit more normalcy. Normalcy being that I can have a conversation with a patient without a mask, that I could drop the shield maybe. That would be. But I think that everything else that we have in place. I think some of the changes, which I think, like I said, are more evolutionary. I think are going to stay in place because it's just another measure of safety that works, and why not? I think dental is always the health profession that is the envy of the rest of the health industry as far as what we do on a daily basis for disinfection. The teams are so well trained, and everybody is so vested to make sure that we do the right thing. Look around. You haven't seen anybody getting sick in the dental office, right? It's a credit to all my colleagues. I think all the guys that are in my club, in my study club. Everybody has done above and beyond. Nobody has just done the bare minimum. Everybody is engaged and wants to make this work.
That's so. So, if you were to kind of, what would you say COVID has taught you, or what have you learned that is really significant during this whole pandemic? You personally.
When we talked last time, and you said, is the sky going to fall? It's like, we're going to still be here, right? And we're still going to move forward. And we've had bumps in the road before, and it's not going to be the last time, right? There's going to be other obstacles. And then you have to make a decision, glass half full or half empty, and where do you want to, make it work. And when mankind wants to make it work, we do. That's why there'll be a vaccine. That's why we'll get back to a state of normal, and we'll get through this. Excuse me.
That's cool. You're getting verklempt. Well, what closing message would you like to give to your patients, your team, your colleagues with regard to everything so far?
Well, I'm absolutely touched by the way the team banded together and had a real gung ho, let's do this. And I'm really I'm so indebted to the patients. I more than I could ever have expected as far as how much they trust that we're going to do the right thing. I would say there's got to be at least 10% of the patients that have told us that we're the only place that they visited since March outside of bare essentials. They haven't been to a restaurant, they haven't been to a theater, they haven't gone on vacation, on a plane, but they're coming to our office because they feel safe, and they know that we've got their back. So, and that's awesome.
That is so awesome. Dr. Paul Bylis, first of all, so appreciate you taking the time, your busy day, taking the time to come in and share with us. Your daughter, Betsy, we got to get her on the show at some point here. Make her talk to me. I really appreciate it. I love to hear that your practice is doing well and that you're doing well. People are safe. Please tell Karen I still haven't eaten, but I might have to go find something to eat later. Inside joke, but we won't go there. If people had questions about you or wanted to contact you, what would be the best way to do that?
They could go to dr.bylis at bylisdental.com. So
and then your website is
Bylis Dental.
Awesome. Well, first of all, thank you so much for joining us. Hey, those of our guests, thank you for being here. If you like the content, please share. If you have any questions for Dr. Paul Bylis or Dr. Elaine, or want to reach out and ask them questions about what they're doing, please feel free to. Really appreciate you taking the time.
Pleasure.
And it's an absolute pleasure. At some point, hope to see you. And big air hug. Please say hi to Dr. Elaine for us. And
sure.
the rest of it.
Okay. Take care. See you later. Bye-bye.
Thank you. Take care. Bye-bye.